One of the most common questions I get is, what is gynecomastia? Men contact us all the time trying to figure out if that's a condition they have. And in the truest sense, it's enlargement of breast tissue right under the nipple and areola. Tends to make it look puffy. A lot of times there's a fatty component too that'll make the whole chest area, the lower chest area, look fuller, even out onto the chest wall. And that, in a sense, is a variant of true gynecomastia, but it still has the same effect of having a more feminine appearing chest, not fitting well in clothes, just having bad lines when you wear tighter form-fitting shirts. Fortunately, we have tools to address this. So usually this is treated with a combination of treatments. Usually the laser is used to break up the fatty tissue and even some of the fibrous tissue. And that's typically done through just a little access point up by the shoulder and one below the nipple inside the areola. So these heal it very well with minimal scarring. Through that same port, then we can use power-assisted liposuction to remove the fatty component. Many times, though, that's going to leave behind just the true gynecomastia tissue, kind of a white fibrous element below the nipple and areola. And we go directly through that areola and remove that tissue by excising anything that we can see or feel in that area, and you can see the contour improve and have a more masculine appearance. Now, if there's enough excess skin after we do the power-assisted liposuction and the laser, then we may actually have to cut out some skin. Obviously, that leaves a little bit more of a scar, but it's going to give a better contour on the chest. A lot of times, along with the treatment of gynecomastia, we'll treat other areas like the sides of the chest and the abdominal area, just to give her an overall improvement in the body contour and a more masculine appearance overall. So what causes gynecomastia? Typically, it's just a hormonal imbalance. Many times it's during puberty. There's more estrogen around before the testosterone gets started, and that'll cause some of the breast tissue to develop. Sometimes that regresses, sometimes it persists, and it has to be removed. Now, there can also be a fatty component as well, and that can also add to the fullness in the chest area. Just through general aging, metabolic changes, some medications, marijuana use, all these things can have an effect on the hormone balance in your body, and that can lead to changes in the appearance of the chest with development of gynecomastia tissue. We have to make sure that we don't have other things going on that are causing this before we treat it. So we might check hormone levels and review any types of medications or supplements that are being used, just to make sure that we're addressing one of the causes of this condition.